Okay, hello everyone. We're here today with Dr. Edward Chauvin and Roger Sims, Dr. Chauvin's patient. And Dr. Chauvin, would you mind introducing Roger a little bit, his case? Just recap it for people.
I'd be glad to. Roger came to see me after 21 years of being in an automobile accident where he flipped the car upside down and his wife was killed upon impact. And Roger had a brain injury. He had burns through like 2/3 of his body because the car caught on fire as well. And when he first came to see me, he could barely move his left side at all. And after 21 years, he's walking now. He still doesn't have the type of balance that he's supposed to have, but we're working on that, and we feel certain that someday he will walk with balance without using any machinery or any problems. So. Excellent.
And how long has Roger been under care right now?
He's been under care about 2 years now.
Okay, excellent. And so, Roger, we have footage from you from about a year and a half ago, and you were moving well back then compared to when you first started. And even now, it's like such a huge improvement from the last time I saw you. How do you feel?
Great. I'm getting better and better.
Yeah. And your body seems much more relaxed. You have much more energy to you.
Right. Things are coming back the way they used to be before the accident. I can feel this. It's not where I have to think about what I'm doing. It's all natural.
Excellent. And we were able to exercise today, and you were talking during your exercising,
right,
and having conversations.
I couldn't do that before.
Absolutely.
I would have to stop and then say a sentence.
When you first came in, you really couldn't understand what he was saying.
That's right.
I understand him very well now, almost too well.
Yeah.
He likes to cut up with me.
So, Roger, in your own words, what would you say Quantum Neurology has done for you over these last two and a half years?
Well, I think it's almost unbelievable because all the other doctors, they just gave up on me because they didn't know what else to do. Every therapy I went in, I'd plateaued within 1 week. And the Quantum Neurology, like I say, it woke up my body. That's the words I use. It brings everything back to life. Because I remember, it was like 3 weeks after I started, I began to feel stuff that I hadn't felt in over 2 decades. Now it was unreal to me. It was like I forgot I couldn't feel this and I couldn't feel that. Now it was just unreal. I didn't know what to think. I knew this was the answer.
Yeah.
I tried everything physically, and I never got any better. But Dr. Chauvin, I asked him, I said, well, after 5 years of physical therapy, I never saw any improvement. Why was that? He said, well, you couldn't get better. It made sense. This is like treating my body as a system rather than an object. It makes perfect sense. I tell people it's optimum reasoning at its finest.
Excellent, excellent. And you know, Roger, some people think that rehabilitation, as quick as our results are, it's not a get-rich-quick or not a heal-quick system. You're putting your time in. You're coming in and you're putting your time in. You're getting the work done, and you're getting the fruit of that hard work that you're putting in.
It's not really that much work, though. It's happening on its own.
Right.
I figured I'd have to work my tail off to make things happen. This is just on its own. You more or less shine the light on me, and I'm getting better.
That's right. Well, and there's a lot of technique behind that, what Dr. Chauvin is doing, and of course you don't have to know how the technique works step by step.
I just know it works.
That's right, you just know it works. And that's what people may not understand. Some people think, oh, that's all in your head. That, you know, that light business or quantum neurology is all in your head. And contrary to what people might think, you were stuck in your body for 21
Right.
years, and it wasn't in your head when you did the other types of therapies, and it wasn't in your head when other things weren't fulfilling your needs. What would you say the difference in quantum neurology is?
I see improvement like that instantly. Seemed like it was every other therapy I had was all the wrong concept. Of course, back then I didn't understand it.
Right.
But now I do.
It's a very good point you bring that up, because a lot of people talk about neurological rehabilitation as if they're talking about going to the gym. Wouldn't you agree, Dr. Chauvin? Neurologically, people think of gym mentality. I'm going to do 10 reps of maxing out, and that destroys the nervous system.
That's not it at all.
Yeah, they think that all they have to do is move the muscle and move the joint through range of motion, and that brings back neurological function, but quite the contrary. It doesn't get anything done, and it doesn't build the muscle if the nerve supply is not stimulated along with it. And that's what I believe that quantum neurology does differently than any other technique out there, including chiropractic.
Absolutely. Now, Dr. Chauvin, you've seen so many cases. Roger, of course, is an exceptional case of somebody who's been in a wheelchair for so many years, over 20 years. And I know you've worked on many, many other cases as well. Would you mind talking just the general concept of helping somebody like Roger? What's that process look like for somebody?
Well, when someone comes in after 20 years of not being able to move anything, it's very much a challenge for me as a practitioner, because I have to find something that is moving to start using that as my testing force to the nervous system. Then after we can build on that function, because I had one lady, she could only move one finger, and that's what we had to start with. We got to move one finger long enough to where she could move her hand, and then she could move her arm. And so neurologically it brought back function in layers of the nervous system. That's the best way I can explain it, until she got back used to that. And the same thing with Roger. When he first came in, his left hand, he couldn't move his fingers more than this when you tell him to move them. And now he can move his fingers back and forth like that. Now that happened pretty quickly within the first couple of visits.
Exactly.
Let's see you do it, right? There you go. And you couldn't move at all before.
No.
Couldn't move at all before.
Yeah.
And so that function has stayed on ever since we first started treating him. And he can go in and out. He couldn't do this at all.
Right.
At all.
He couldn't do that at all.
And what I noticed was the feelings came back, and then it's like you said, layer by layer. First the feelings came back, and then the involuntary movements returned. I found that was so neat.
And a lot of patients that come in, they don't realize that when you turn a nerve signal back on, sometimes the first thing that comes back is pain. And they go, well, I don't want any pain. But, life starts with pain and ends with pain, and pain is not necessarily a bad thing if you can work through the rehabilitation and eventually get rid of the pain. But they don't understand the concept, because they're so used to the medical model of, oh, it hurts here, well, let me inject it there, and we turn off the signal, and I don't feel any pain there. That's what I want. Well, that doesn't bring back nerve function the way we're bringing back nerve function.
That's right. I like talking about the emergency alarm of a door. When you open that emergency alarm, the alarm goes off until that door is shut again.
Right.
The same in our body, the emergency alarm is pain. And that lets us know that there's some disconnect somewhere.
Right.
And it won't turn off until we reconnect it again. And that's a real powerful understanding of the nervous system to heal itself. Very powerful.
So Roger's come a long way from not being able to talk, not being able to move his hand, not being able to walk, and now he walks so much better.
It's a good feeling.
You look great, Roger. I mean, just the relaxed nature of your body, where before you were stuck in your body.
Right.
Now your body's working for you.
Exactly.
And it
will
brings,
make y'all proud of me. Yes.
Well, after it brings back the motor function and gets muscles to fire, then the sensory can return, and then the cranial nerves return, and then
Right.
the patient goes, wow, I feel like I used to feel before the injury. You know? Yes. Exactly.
Now, you know, one of the premises in quantum neurology is that we're not treating, we're not curing, we're rehabilitating.
Exactly.
You know, you can't cure somebody from getting hit by a bus.
Exactly.
Right, we're rehabilitating their body, we're restoring the function.
Yes.
And could you speak to that, Roger? Because you have such a profound experience with it.
He was the first doctor that told me that I can't get you where you were before the accident, but I can get you close. And I said, well, I have to see this. And then, sure enough, it's like nothing I've ever even seen or heard of before in my life. You tell people, hey, oh no, if it sounds too good to be true, it is. I said, well, I'm going to find out. And I'm glad I came.
I'm glad you came too.
Me too.
Now, both of you, I'd like to talk about, you know, well, Roger, you can answer this very well. What did you do before quantum neurology? You don't have to name details, but just what kind of therapies did you investigate?
Every physical therapy they had.
Yeah.
What, you know, aquatic therapy. Just everything, stretching, strengthening.
Right.
You did electrical stem?
No, I didn't do that.
You didn't waste your time.
No,
it's
exactly.
a good thing. I consider electrical stem low-level electrocution.
Yeah, exactly.
When you're dealing with somebody who doesn't have, they're paralyzed in some way, it may fire that muscle, but it doesn't make the neurological connection from your brain to that muscle.
Right.
It's firing it externally. So it's good for the idea of not losing muscle tone, but it's not good for restoring that function.
Right.
But the now, you know, Ed, I wanted to talk to you about, you know, I feel a lot of people have resistance, whether they have a brain injury or otherwise, you know, and of course we're talking about spinal injury, brain injury right now, but also athletes benefit from this work as well, as you know.
Yes.
But what is it that people need to know because they think, oh, it's not real, or, you know, they have all these ideas of what we are without knowing what we're about. What would you say to somebody, either a doctor or a patient that's investigating this for rehabilitating themselves?
That's a great question, George. I'm going to try to address it this way. I have a lot of people that come in here that have had paralysis, or post-stroke victims or whatever, and I tell them all before I get started, you know, when we see results, get excited about those results and not what you don't have yet. Because so many people that come in here, you know, they can't move their arm up or down, and you get it to move up and down, they go, well, that's pretty good, but I still have pain right here. They focus in on the negative instead of focusing in on the miracle that just happened. They couldn't move it at all, now they can move it.
That's right.
And I tell all my paralysis patients, this is going to be slow. You got to celebrate the victories that you have and keep adding to the victories until you get to the ultimate goal of walking out of the chair without any help. And you know, you have to celebrate the victories along the way. It's kind of like the old saying, a mile is a trial and a yard is still hard, but an inch is a cinch. If you just keep going an inch at a time, you'll get the mile that you wanted to travel. But if Roger's never been one of these people. He's always pretty much celebrated the victories that he's gotten, and we've built on them from there. But I get quite a few people in here, and I hope I don't get any more just from making this video, but yeah, but the pain is still there.
Right.
You know, if there was a doctor anywhere in the world that could get the function back to a shoulder that won't move and take the pain out all in one time, you would not be able to see all the people in the world that would be flooding your office. Because the body cannot heal that quickly. It's like Jim said, you know, you have to wait for the paint to dry.
That's right.
Before you see what the next step is. And so that's rehabilitation. Nerve rehabilitation works like that. If you can get the patient focused on where we want to go with this and celebrate the victories all the way along there, then you get to the ultimate goal of, wow, I'm well now.
Right. And it is a process.
Yes.
It's a process. And, you know, taking Roger from the, you know, toughest of the toughest scenarios, being in a wheelchair for over 20 years, to where he is today is tremendous. Tremendous
I thank
result.
God for being a part of it. You know, I know that this is something greater than me, something greater than us making a video.
Yeah.
It's a man that couldn't walk that now can walk.
That's right, baby. I love it.
I love it when that happens.
I think this would be beneficial for any human being on the planet that has a central nervous system. That's what I think.
Now, you know, speaking to people that have been injured like yourself, they're at home, they're frustrated, they've lost hope. You know, we talked earlier, you've kept your hope 20 years plus after your injury, and then you found us.
Right.
Some people give up the first, like, as soon as they hear that they have a problem.
Mm-hmm.
And what would you say to those people? Talk directly to those people and tell them what your experience is and why they should explore this concept.
Well, yeah, I don't really know what to say about that. It's just, it's more than you can imagine. After hearing years, the doctor said, "Well, you're about as far as you're gonna go." Or I understand now that we're all looking at it from a medical standpoint. This is something totally new. What I like about it is you can see results instantly, right before your eyes. No medicine, no pain, just nothing but results. That was so cool.
It's an amazing experience when your body heals in front of your eyes. And
it is.
It's a journey. It's a journey, and we can't relive those gains that we've already gotten. We're continually going for the new gains.
I remember telling a friend about this before I even started. He said, "Oh, that sounds like snake oil. You better stay away from it."
Right.
I said, "No, I'm curious. I'm going to see." And thank God I did.
Good for you, buddy.
It's like one of the famous chiropractors, B.J. Farmer, said. They asked him a question one time, "What do you owe all of your successes to?" And he answered one word: results.
That's right.
And, you know,
exactly.
That's what I thank God about. Results.
Absolutely.
You can't go wrong, in my opinion.
Yeah.
Nobody on this planet can go wrong with it.
I love it. Is there anything you want to tell Ed?
Well, yeah, thank you again.
Oh, it's been my pleasure, Roger.
Oh, yeah. He's not so bad of a guy after all.
I cut up with him a lot and act like I'm going to hurt him and
you
stuff.
gotta have fun.
I'm playing with him because this work is so complex that you
have
have to laugh a little bit along the way.
Exactly. You have to have fun.
That's right.
If you make it fun,
it's worth it.
Then he wants to get into it. But if you give him doom and gloom, that doesn't make him want to work at it.
No.
You got to make people want to work at their rehabilitation.
That's right.
And I try to do that with Roger.
And you know, I said earlier, you've been putting your time in, and you said not so much compared to possibly other things that you've done. But 1 hour a week of rehabilitation, would you say that's ideal for somebody in Roger's situation, or would more be ideal? I don't know if distance is a factor.
It would be a lot more ideal if I could see him more often than that. But that's all that he can get here because he comes from Lafayette, and that's all he can afford to do financially. So,
got it.
You know, with a limited amount of money that we can spend on this, we're doing the extreme results that we've gotten already.
Right. And now, you know, without getting into the details of the finances, if you were to compare the cost of doing this work compared to the cost of the rehabilitation you've done in the past, could you speak to that?
This is not, I can afford this on Social Security disability. which is, you know how much they pay on Social Security. They give you just enough to die on, which is true. I mean, think about it.
Yeah, and you can afford this care
Right.
with that.
It's extremely affordable.
Incredible.
Listen, there's a lot of good medical doctors, there's a lot of good chiropractors, there's a lot of good quantum neurologists, and I don't want to talk down about anyone. I will tell you this, though. I think it's funny when people act like we as quantum neurologists make too much money. Because most of the people that I see that are in wheelchairs for 21 years, their insurances have completely exhausted the limits of their policy before they ever start here.
Exactly.
They spent $2 million on this insurance, but they worry about paying a $40 bill over here, and I tell you, I have problems with that.
I
really
do too.
do. I really do.
I do too. I feel the focus needs to go away from expensive diagnostics that don't change the person's life. You know, yes, it's necessary for certain things, but it seems like the business machine in the chemical pharmaceutical model is on paying exorbitant amounts of money for diagnostics, and the patient's just as sick after the diagnostic than before, except they're thousands of dollars in debt or out.
Yeah. Like not to run anybody down, but was there any drug that ever helped you rehabilitate?
Not that I know of.
Was there any surgery that ever helped you rehabilitate?
No.
Was there any physical therapy that ever helped you rehabilitate?
Not a one.
Huh.
I had a $1 million policy at work. I exhausted that.
How long did it take you to go through that, if you don't mind asking?
I would say about maybe 5, 6 years.
Wow.
They tried everything on me. I mean, I got good care and everything, but it just wasn't effective. Until I heard about Dr. Ed here.
Yeah. I love it.
I love it. Thank you, Jesus. I love it when that happens.
It sounded too good to be true, so I said, well, since he's so close, I have to go see this. And then I was surprised. It wasn't like all the other doctors that would know all my medical history. Not this fella. I don't care about them operations, what medicine you took. I didn't understand. I said, well, this is kind of strange to me. But now it makes perfect sense. But it wouldn't have an effect on it anyway.
Your T-shirt that we gave you, what does it say on it?
Embrace the light.
It says, the people that say it can't be done
Or
are always being passed up by the ones doing it.
Exactly.
Embrace the light. That's what it says.
Yeah, I do. I thought.
When they say it can't be done, they come over here.
Exactly.
That's right.
They do. And I'm not saying that I'm great. I'm saying God's great and He uses us.
Yeah, I want to be the poster child for quantum neurology.
You are, man. You are. Just simply by showing up and working on your nervous system and demonstrating what's possible to other people. Right. Because we can't claim that we're curing strokes or brain injuries. We're just strengthening the nervous system, and you're a perfect example of that.
I hope the entire planet hears about this or becomes aware of what quantum neurology can do.
Me too.
Me too.
I hope I can help make that happen.
We're doing it right now.
Good deal.
So is there anything else you want to share, Roger?
Just go see quantum neurologist for anything. I'll say that for anything, but I'm sure there's maybe some limits, but they got to be very few.
I love it. Well, Roger, you're an inspiration to me as a doctor, and so are you, Ed. It's just so amazing to see it in action, and to have met you. You know, I happened to be here last time. Met you on your second session.
Now we know why God's first words were "Let there be light."
That's right.
I think that's so cool.
It is.
And you know, without George's technique that he developed, that God gave him, I wouldn't be helping you, Roger. That's why I'm so glad to have George here. You know?
Exactly.
He's always welcome. Like I told him, I said, George, one thing, you're never going to starve because I'm going to bring you food to eat, I promise.
That's the man. That's the man. Right?
That's the man. That's the man.
And you feed me well here in Louisiana, that's for sure.
You won't go hungry around here. Right?
That's right.
Let me show you.
Well, I love it. I love you both. Thank you so much for sharing.
Love you too, George.
Thank you.
Again, you're an inspiration, Roger. Thank you so much.
Thank you.
Thanks, Roger. You did great, man.
Thank you.
Well
You
done.
all right?